tonight on 10 Tampa Bay, COVID-19 wasn't the first pandemic, and medical experts tell us it will not be the last. Just days ago, Vice President Kamala Harris addressed the United Nations about being prepared for the next pandemic as we continue to fight this one.
We need to invest in science, health workers, the well-being of women, and our public institutions so they are prepared for the next emergency. And finally, we must be responsive. We need surge capacity in every region so that every country can access personal protective equipment, vaccines, and tests.
So how do we as citizens prepare for something like that? 10 Tampa Bay's Jenny Dean joins us live with more on what we need to do. Good morning, Jenny.
Yeah. Good morning, Caitlin. You know, this really boils down to what we can do to help ourselves. And every year in Florida, we deal with something that could be a public emergency, hurricanes, and being prepared for those hurricanes. And how we do that, how we prepare, we could really learn some lessons on how to prepare for the next pandemic.
You know, you see it coming. We can predict a little bit better. People take it more seriously. And they board up their houses, they get their water and their toilet paper, and they exit when they can. And that's worked, and we've done very good at that.
Dr. Jay Wolfson is a public health expert from the University of South Florida. He says when there's a hurricane, we get very clear messages from our local and state government on what to do and where to go. And in most cases, we listen. But we also take on that personal responsibility of getting our own hurricane kit together. Experts say we need to do the same for a pandemic.
Personal responsibility is the absolute core factor that will define our ability to manage against it, but we're not very good at that.
Author and concierge physician Dr. Ken Redcross agrees that we should all plan ahead.
And I love the fact that we're talking about this preparedness when it comes to viruses. Obviously, our focus right now is on the coronavirus, but influenza is still circulating and these viruses may continue to come.
He recommends putting a kit together now to protect you from illness. If you don't have a thermometer by now, get one. When your temp is above 100.5, talk to your doc. And keep supplies of vitamin D, magnesium, and probiotics. Take them regularly. Have a good supply of masks, gloves, and antibacterial wipes on hand at all times. And finally, this is something Dr. Redcross wrote a book on. Create a relationship with your primary care doctor.
That patient-doctor relationship, we should have four things. Should have trust, respect, empathy, and communication. And all four of those are huge during this time of the coronavirus.
That trust and communication will come in handy when you're getting mixed messages from other sources. And the future may be uncertain when it comes to pandemics, but we can be certain about one thing, and that's taking care of ourselves.
This day has come, and it's something for us to really think about and make sure that we're realizing that, you know, these germs, our environment, everyone is teeming with these things, but now we're more mindful of that because of COVID.
You know, a couple more things to consider when it comes to pandemics and illnesses. Dr. Redcross says it's really important that if you have any sort of chronic condition that you get it under control and you're doing what your doctor tells you. And also, this one's a given, but it's one everyone struggles with. Get plenty of sleep and exercise regularly. Caitlin?